Hey there, this video is going to cover what patellar tendinopathy is and how to rehab it based on recent research. We'll then go through the progressive exercise stages with plenty of examples, and then move into more sport-specific exercises for cutting or jumping sports, which is going to be the last stage of rehab. So my name is Dr. Becca and I'm a physical therapist, and let's get into it. First, pain symptoms of patellar tendinopathy will be precisely located at the attachment of the tendon to the tibial tuberosity, which is the lower portion of the tendon, or at the attachment of the kneecap, which is the higher portion of the tendon. And you can feel pain at either both or one of these sites. The primary reason why you have pain here is because there is an overload of force to the quadriceps muscle, which caused tensile failure to the patellar tendon tissue. And if the cycle is repeated enough times without adequate recovery, this can cause microtrauma to the tendon. This is sort of like a stiff piece of rope that has been used and stretched out too much, too fast. The result is that portions of the tendon that have been weakened will have a reduced ability to transfer forces from the quadriceps muscle if the quadriceps muscle is weak during the goal activity or sport. That's why patellar knee pain is most common during certain knee activities such as jumping, squatting, stepping down the stairs, cutting sports, and running, because these activities take a lot of quadricep muscle strength and power. So you're probably wondering, how the heck are you supposed to exercise your knee again when you have knee pain? So in order to get back to your goal activity or sport, we have to look at three main exercise principles for the patellar tendon to undergo in order to return back to its normal function. These are appropriate load, velocity, and volume, and these exercise principles will be progressed and adapted based on the goal activity. So load can be considered as weight, velocity as speed, and then volume can be considered as either number of repetitions or time. So taking a weightlifter compared to a soccer player, we can say that the weightlifter is more of a power athlete and will have more of a focus on progressing load compared to velocity and volume throughout their rehab. In comparison to the soccer or basketball player as endurance athletes, they will have to focus their progressions on enhancing velocity and volume of quadriceps exercises in order to get back cutting or jumping ability, and doing this often enough. So now that you know about these exercise principles, you're probably wondering how to manage your knee pain. So A. Rosen et al. Has stated that the threshold for pain on a visual pain rating scale during exercises should not exceed a 5 out of 10 pain rating, and this should be less than a 5 the next day. So for example, if a new set of exercises or activities such as basketball drills is causing a slow increase of pain again, the best recommendation is to reduce that activity by either load, velocity, or volume, where volume can be considered time as well. It's not always indicated to take away that activity completely, as this can offset progression, but carefully reducing either load, velocity, or volume, or in combination of these first. Now, if you're somebody who has been struggling with patellar tendinopathy for 3+ months, I personally would recommend changing your pain threshold to 3 out of 10 pain rating, as this would allow more quality recovery time to happen to the tendon tissue. So all in all, daily vigilance on knee pain self-assessment should become a daily habit in order to allow for quality maturation to occur to the tendon tissue. So we can expect some amount of pain, but without overloading the tissue to a more damaging response. And that is why we use the pain rating scales for this. And now that brings us in how to complete these exercise progressions for the patellar tendon. So there has been a lot of good clinical research in the last 5 years with more precision in the patellar tendon exercise progression into 4 stages. One major research update in the last 2 years is where Breda S.J. et al. In a randomized controlled trial concluded that progressive patellar tendon exercises were superior to only eccentric exercise therapy in regards to pain and return to sport after 24 weeks. So based on this research, I'm presenting a suggested progressive patellar tendon loading program along with return to sport drills and explosive exercises by stage 4. So starting with the first stage, symptom management and load reduction could range between 0 to 4 weeks. Sport participation is suggested at less than 25%, And if you're in a jumping or running sport, an activity substitute for this would be aquatic exercises or cycling. Clinical recommendations for pain will be 5 out of 10 or less during and after exercise, and less than a 5 the following day. So the purpose of this stage is to reduce noxious stimuli to the knee in order to start a progressive recovery. Begin quadriceps loading, and the exercises should assist in reducing your knee pain. These exercises are focusing on isometric quadriceps contractions, and there are several methods to complete this with increasing difficulty and done daily. So starting with our easiest option is to have your knee in full extension while sitting, then completing 5 reps of 30-second quadriceps contractions. You can increase the volume with either number of repetitions or holding up to 60 seconds. The next progression is to add an appropriate load for this by either using a machine or, if none is available, getting creative and trying a TheraBand method from home. So volume for reps or hold time can also be increased here. Now moving on to our harder versions, which is involving body weight isometrics, we can do the double leg wall sits, or a harder version from this is a Spanish squat. Either is fine based on preference and working up to 5 reps with 30-second holds. The hardest version for all of these is involving the wall sits or the Spanish squat by increasing the load and holding single leg holds.
Feel the burn!
In addition to the exercises, Demetrius et al. Has also found that quadriceps and hamstring stretching before and after eccentric exercises to come was superior in reducing patellar tendon knee pain in comparison to not doing any quadriceps stretching at all. So 2 methods to do this are either lying prone or standing, with the middle of your knee aligning at least to your greater trochanter or hip bone, or past this. These stretches would be done throughout the entire rehab. So recovery is stage 2, and this will range from 2 to 6 weeks. Sport participation can increase to 50% or less, and pain during and after exercise still remains at a 5 out of 10 rating or less. Now, the purpose in this stage is to increase patellar loading with more isotonic or dynamic exercises using concentric and eccentric quadricep muscle contractions. And we're beginning to add more physical activities such as submaximal jumping and squatting. Beginning with concentric exercises, you can use a machine at appropriate weight for double leg extensions at 3 sets of 10 reps, and then increasing the load or the volume to 15 reps. A TheraBand method from home can also be used to substitute a machine with the same progressions. To progress with eccentric exercises, there are several stepwise progressions to trial in this stage. We can start with double leg squats with a focus on knees, going slightly in front of the ankle joint, and then going slightly over the toes with a 20 to 30 second count. To progress, there are options by increasing load with weight and volume with repetitions. The hardest option for eccentric strengthening in this stage would be completing the same squats on a 25-degree incline and completing slow isotonics at a 3-second count going down. The same progressions can be made with load using a weight and increasing the number of repetitions. Take it slow. Submaximal jumping can also have stepwise progressions that can involve first jumping in place, double leg, or with a jump rope for reps or time. Jumping from an elevated surface is also a submaximal jumping option. Rebuilding is stage 3, ranging between 4 to 12 weeks, increasing to 75% or less of sport or activity participation, and now trying to maintain a 3 out of 10 pain rating during and after exercise. So the purpose of this stage is to focus progressions from the last stage by adding more load to the knee, for example by using more single limb exercises. Exercise frequency can be a suggested 3 to 5 times per week, now as activity participation will be increased simultaneously. The first progression will be single leg decline squats while still at a 25-degree angle and still moving slow through a 30-second count. However, if this progression is too difficult, there are also other options to work up to this by first completing a lateral step down while still working up to a 30-second count. This position allows for a little less knee flexion to be reached, and then there is also the option of a forward step down prior to the decline. The stage will also increase load during different squatting variations that can be progressed with the leg press, the hack squat, and a back squat. For any of these options, the goal would be to reach 4 sets of 15 reps max, and then progressing to 6 to 8 reps max as the load increases. Moving on to jumping and plyometric progressions in this stage, there are several options based on the specifics for your sport, but still mediating knee loading. This can include double leg forward hops, double leg side to side hops, double leg broad jumps, double leg broad jump to vertical, jump squats, and jump rope with alternating single leg hops. So just a heads up, I put all of these exercises in a PDF found below in the description. There's a little bit more detail on how to complete each exercise with the picture for a small fee, if this is something that interests you. And now for the final and fourth stage for patellar tendon rehab is returning to full sport participation by 12 plus weeks and with minimal to no pain. The purpose of this stage is to continue loading the knee in order to enhance sport participation and explosiveness, but also preventing re-injury. Exercises will now be decreased to 2 to 3 times per week due to the goal of 100% sport or activity participation. So starting with the single leg decline squats at 30-second count, we'll continue to do this along with increasing weight as appropriate. Different squatting exercises will also continue to be performed with the goal of 4 sets of 6 reps max, while continuing to progress the weight. In order to enhance full sport participation, we now have to progress with more difficult single limb jumps and cutting drills in order to enhance sport explosiveness. A suggestive workout can include from easiest to hardest, single leg jump rope for 30 to 60 repetitions or for 1 minute, single leg forward hops on a ladder, single leg side to side hops, again using a ladder or another elevated object, 90 and 180 degree jumps, skater jumps with a hold, single leg skater explosive jumps, single leg forward explosive jumps, double leg jumps over hurdles, and single leg box jumps from the side. So in summary to this program, it is evident that this injury requires a gradual progression to knee loading using our progression principles of load, velocity, and volume, and then adapting these to your own specific needs and pain symptoms. It is also very true that not everyone's patellar rehab will look the same, and durations for a full recovery can vary. So please keep this in mind as I've presented a very generalized rehab program, regardless of age or personal factors. And as I've said before, and I'll say it again, please consider subscribing to the channel, liking the video, or commenting below so this video can reach the same audiences if you think this video was useful for you. So thank you so much for taking some time with me today, and I hope you have an amazing rest of your day and a better knee. Take care. Patellar tendon exercise progression. And the patellar tendon exercise progressions in the... Oh, God, I feel like grandma. God. Whew, it's getting chilly.